Good afternoon, members of the council. My name is Michaela Pullins, and I'm here today to discuss a critical health issue facing our community, which is racial disparities in maternal and infant mortality in Dayton and Montgomery County. This issue is not just about health outcomes, it's about fairness, equity, and the future of our families and neighborhoods. In Montgomery County, infant mortality remains a serious concern. While the overall infant mortality rate is 7.8 deaths per 1,000 live births, the rate for Black infants is much higher, sitting at 13.1 deaths per 1,000 births, compared to just 7.1 among white infants. This means that Black babies in our community are nearly twice as likely to die before their first birthday as white babies. These numbers are not just statistics, but they represent families who experience devastating loss and communities that carry the burden of preventable health inequities. This disparity is deeply connected to maternal health. Black mothers face higher risks of complications during pregnancy and childbirth, including preterm labor, high blood pressure, and postpartum health issues. Many of these outcomes are tied to social determinants such as poverty, limited access to quality prenatal care, transportation barriers, and the ongoing stress of racial discrimination. The consequences of this disparity extend far beyond individual families. Babies born prematurely or at low birth weight often require more intensive medical care, adding to healthcare costs for families and our local health systems. Developmental delays can also impact school readiness and future academic success, perpetuating cycles of poverty. But most importantly, these inequities erode trust in our healthcare system and highlight the urgent need for systemic change. There are programs in place today, such as the local Office on Minority Health and community outreach from local hospitals that aim to improve maternal and infant outcomes. Some organizations offer prenatal education, some offer home visiting services, and support groups for new mothers. While these efforts are very important, they're not reaching enough of the families who need them the most. The gaps are clear. There's many families who still lack consistent access to prenatal care. Transportation and childcare remain to be barriers to attending appointments. There are cultural differences and medical mistrust that can prevent families from seeking available services. And funding for these programs is often very limited and inconsistent. To reduce some of these disparities, we need targeted community-based interventions. I recommend some of the following. We can expand home visiting and mobile health programs that bring prenatal and postpartum care directly to the families in underserved and underrepresented neighborhoods. In our communities, we have to learn how to meet the families that we serve where they're at, and that's where we find the most success. Secondly, we can partner with trusted community organizations such as churches, cultural centers, and grassroots groups so that families hear messages about obtaining optimal levels of health from people that they know and trust, people who have lived in the communities, people that work in the communities, people who have experienced some of these things themselves. We can also provide transportation assistance or vouchers for pregnant women to attend these appointments. And not just pregnant women, but also mothers who have small children. We have to think about the load that they have to carry when it comes to prioritizing different things, when they have all of these other barriers going on. And one of those things might be that they have other small children that they have to take on the bus or change the car seat from one vehicle to another, which can be discouraging for some. We can also increase culturally competent care for training and providers. This is a big one because in reality, we want the mothers to feel heard. We want them to feel respected and safe. A lot of times there's a language barrier, and not necessarily a language barrier where they speak a different language. However, there's a miscommunication in the understanding of medical terminology that comes from our providers. And sometimes that causes a disconnect in what our families are able to understand, and they may not be able to care for themselves or care for their babies as they should just because they didn't understand the language that the providers were speaking to them. And lastly, we can launch communication campaigns. This can be done on social media, radio, and at local community events that specifically target neighborhoods with higher infant mortality rates, ensuring that the messages are clear, that they're culturally appropriate, and accessible to multiple languages. So, members of the council, the racial disparities in maternal and infant mortality are preventable, but only if we act with intention. By investing in community driven health initiatives, by expanding access to care, and by improving communication strategies, we can give every mother and every baby in Dayton and Montgomery County the best possible chance at a healthy future. And together we can close that gap. Together we can save lives and we can strengthen our entire community. So thank you so much for your time and for your commitment to addressing this critical issue.